press briefing. Today, Orange County Mayor Jerry O. Demings will discuss holiday travel, how it affects you, and ways for you to stay safe and healthy. And on that point, Mayor Demings will also discuss opportunities for both COVID testing and vaccinations, as there are many opportunities still available. The mayor will also have details on blood drives, rental assistance, and more. And he also has a very special recognition for us today. Dr. Raul Pina from the Florida Department of Health in Orange County is also here to discuss his important details regarding infection rates and state vaccinations. We begin with the mayor.
All right, thank you, Dr. Williamson. We're joined today by Commissioner Nicole Wilson, and I'm sure Commissioner Gomez-Cordero will be coming in shortly. She always joins us. But before I get into some of the formal things that Dr. Williamson talked about, I want to talk first about our level of preparation to deal with any type of disaster or crisis management here within Orange County. Earlier today, we participated at our Emergency Operations Center in our senior officials workshop. And that is an opportunity for the senior leadership within the county to come together to resharpen our saw, to make certain that we are prepared and on top of our game to meet whatever the crisis may come before us. Even though we're in hurricane season and we have to deal with natural disasters, I want to point out that 12 members of the Orange County Fire Rescue Department were deployed this past weekend to Surfside, Florida, to assist that community in dealing with the building collapse there. The Urban Search and Rescue Team was initially deployed for up to 7 days, and we are not certain at this point, but it's likely that they will be extended. You all have seen the calamities and the tragedies that have occurred as a result of that building collapse. But fortunately, here in Orange County, we have staff that are really well trained, and they are able to assist with that search effort. So our prayers are with those in South Florida and Surfside and Miami-Dade County for what they are going through there, and to those families who have lost loved ones and those who it's uncertain at this point. We know that that's a difficult thing for them to deal with. It's an emotional roller coaster, and our community has certainly dealt with its share of similar types of disasters with Pulse nightclub tragedy and other things that have occurred here. So before we move forward in terms of preparation, I only shared that with you just so that you understand that just how good Orange County is prepared to deal with tragedies. So I want to take this moment to also talk about the upcoming holiday this coming weekend. We have received a number of pieces of data that indicates that this will be an active holiday period as we approach the 4th of July or the Independence Day. It will likely be one of the busiest for Orange County. AAA is forecasting the 4th of July holiday travel will be close to pre-pandemic levels, trailing only 2019. They estimate that 47.7 million Americans will travel during the holiday starting on Wednesday. Most of them will be traveling by automobile. Our theme parks appear to be the dominant destination for road trips and flights. Our airport has been extraordinarily busy the last few days. AAA Travel Booking Show Orlando is the #1 spot for tourists this holiday. That bodes well, obviously, for our tourism economy. Remember, it was just over a year ago. We were in the midst of the pandemic, with Florida reporting more COVID-19 cases than California, Texas, Arizona, and Georgia. But the contrast now is that we have reopened and things are going very well for us. Fully vaccinated families will be able to get together again to celebrate without significant fear of getting ill because we have now received the vaccine within our community. But for the families of children who have not been vaccinated, we want to remind everyone to continue to practice safe measures. Dr. Pino will tell you about the 3 W's. Wash your hands or use hand sanitizer. Wear a mask or covering over your nose or mouth if you have not been inoculated, and watch your distance. Right, Dr. Pino?
Yes, sir.
All right. So we want to make our holiday period as safe as we possibly can. As far as the COVID-19 numbers, since May the 22nd, our 14-day rolling positivity rate remains below 5%. However, we have experienced a slight increase in our numbers. Our 14-day positivity rate is now 4.1%, which is an increase of about 0.4% from June the 18th. More and more residents continue to get vaccinated, and we need that to continue. The Florida Department of Health in Orange County, Dr. Pino's staff reports that 57.86% of the county residents 12 and older have had at least 1 dose of the vaccine, so nearly 58%. Since the start of the pandemic, there have been 146,186 coronavirus cases in Orange County, and sadly, 1,351 residents have lost their lives in the pandemic. Our I Got My Shot campaign is working well. The mobile vaccine trailer will be in 5 locations in the coming days. Tomorrow morning, the trailer will be at Goodwill on South Orange Blossom Trail. On Wednesday morning, it will be at Lake Eola at the corner of Roslyn and Washington Streets. Thursday morning, the vaccine trailer will be at Goodwill on West Colonial Drive in Winter Garden. In the afternoon, it will be at Bravo Supermarket on North Hiawassee Road in West Orange County. Then on Friday, you can get a vaccination at the 7 Bites Bakery, which is located on Primrose Drive in the downtown Orlando area. Barnett Park will continue to be open for both testing and vaccinations between the hours of 9 a.m. to 5 p.m. However, this coming weekend, on Sunday and Monday, that's the 3rd and the 4th of July, Barnett Park will be closed for vaccination services and testing services in observance of the Independence Day holiday. The park will then reopen and will remain available to our residents for testing and vaccinations through July 31st. And we also want to ask our residents to support the blood drives that are going on. Blood supplies are still critically needed in our community. Tomorrow, blood drives are scheduled for 9 a.m. until 2 p.m. at the following locations: the Apopka Zellwood Neighborhood Center for Families, the Bithlow Neighborhood Center for Families, and Winter Parks Neighborhood Center. For more information about where the blood drives will occur, you can go to oneblood.org, oneblood.org. And now I'll shift a bit and talk about our rental assistance program. This is a program that is available for individuals who have incurred financial hardships caused by COVID-19 and find themselves with past due rent. The CDC recently extended the eviction moratorium through July the 31st. While this is helpful for many people who are still struggling to pay their rent, it is expected that this will be the last extension of the CDC's eviction moratorium. So we want to make sure that our residents know that there's help available through the Orange County Emergency Rental Assistance Program. You can access information on our program by going to ocfl.net/rental assistance. We are providing dollars for residents who live in unincorporated Orange County and who live within the other municipalities with the exception of the city of Orlando. And finally, I want to recognize one of our behind-the-scenes heroes, I'm going to call him at this point. And during the last 15 months, you all have not seen Carlos Durden, but Carlos Durden is one of our stars at the Emergency Operations Center. He has worked for Orange County for about 6 years as assistant emergency manager. He's the number 2 person in our Emergency Operations Center. Prior to coming to Orange County government, he served in the United States Air Force, and for 12 years he was one of their emergency managers. Carlos is an expert in disaster preparedness and biological, chemical, and nuclear defense management. With 26 years of military and civilian experience, he has been part of multiple events, 20 real-world activations, including the September 11th terror attack on the Pentagon and the 2011 Fukushima nuclear disaster in Japan. Through his hard work and guidance, he was part of a team that helped Orange County successfully navigate the pandemic for these last 15 months. And so Carlos Durden, he's there in the room. We're going to have Carlos come up at this point and just be recognized. And I want you all to see this gentleman. Thank you, sir. So we're proud of the work that he does with the talented team. They were working with Division Chief Avery, who is here, who you have met before. They helped to facilitate the senior officials workshop this morning. So thank you, Carlos, for the work that you do. All right. And now I'll pass it on to the famed Dr. Raul Pino, Director of the Department of Health in Orange County.
Good afternoon, everyone. Thank you, Mayor. As the Mayor mentioned to you, the total number of cases, resident and non-residents, that have been diagnosed in our county is 146,186, and 2,393 of those were not resident of our county. The total number of deaths is up to 1,351. I will give you more data on that immediately. But I want to call people's attention to the fact that since June 23rd, the 23rd, the 24th, the 25th, and the 26th, every day we saw more cases than the day before. Although the increases are not significant, they are important to keep track of it. We think that this may be related to the entail of cases that may be related to the last holiday that we have. And with that, we want to alert people to the new coming holiday. This pandemic is not over. Still almost 50% of our population, we'll say 40% of our population at least, has not been vaccinated yet with one dose. And those tends to be in the young segment of the population. It is important. Also important, there are several data points that are indicating that it's a small increase, is the fact that for the last 3 weeks, week 24, week 25th, and week 26, the negative growth has reduced by half. So we are basically in a plateau with a little inclination up. The positivity rate has also increased slightly. The Mayor mentioned to you yesterday, with 112 cases that we have yesterday diagnosed, our positivity rate for the day was 4.9, and the positivity rate for the last 14 days continued to be below 5, it's at 4.1, but that's a slight increase of 0.5, as the Mayor mentioned to you. What it continued to be significant is the decrease of which deaths are occurring. Although we have seen the last week, there were some reports about, I'm looking for the information right here, is 19 deaths, but most of those are from May of this year that got assigned through the state. I have it here. So the median age was 65, as I said, 19 additional deaths. 13 were female, 6 were male. 9 are from May and 10 are for June. So far in June, this far that we know, 16 deaths occurred in June. With regard to the variant cases, I know there's a lot of interest in the community with regard to the Delta and other variants. There is a significant, the number of Delta has increased up to 23. And we have one death that is suspected to be on one of the Delta cases. I say suspected because it has not been confirmed by the state. But we also have other deaths prior to this occurrence with other of the variances. With regard to immunizations, we have given in our county 1.3 million doses, and the percentage that we are accustomed to follow are as following. Eligible residents with one dose, or at least one dose, 700,983, and that is effectively a 57.8% of our population. And eligible residents with complete series is at 49.6%. So what we are seeing now is a lot of second dose and less of the first dose. And that's why the number of completed vaccination is getting closer and closer to the at least one dose that we have. And if you follow that number, it has increased significantly the second dose. For our younger population, we continue to encourage parents to vaccinate their children. Schools is coming back. That's a congregated environment. We have no mask mandate in our county, and we have variants that are more infectious and more aggressive. There has been a reported increase of hospitalizations across the country, not in our county, but across the country, with people of younger age due to some of the variants. So it is critical, important to get vaccinated and to get vaccinated as soon as you can. The race right now here in Orange County and the nation, it is vaccinations versus variants. Who gets first? Do you get vaccinated, or we get to a variant that is resistant enough that will make a difference in people who are not vaccinated or even those who are vaccinated? It is important, critically important, to get vaccinated. If we all get vaccinated today, we can eliminate this virus from this county in 6 weeks. 2 cycles of 3 weeks, if we all get vaccinated, it will be as simple as that. We have the tools. Please have use of those. Thank you.
All right, thank you, Dr. Pino. We do have from Orange County Public Schools also Ms. Sherry Babinski, if there are any questions related to the school district. So with that, we'll open it up for any questions at this time.
Steve Hudak from the Orlando Sentinel. Lauren Seabrook's not here today, so Dr. Pino, on behalf of Lauren not being here.
Oh, just watching.
So, where are we with the variant? We're the Delta variant. We about doubled from last time. People are saying it's more infectious, that it's more aggressive. So, if you can elaborate a little bit on what you just said about variant versus vaccinations.
Yeah, we have 23 cases of the Delta variant so far that has been reported. Now, let me say this again, and we said it with all the variants. That has been reported. I'm pretty sure those numbers are higher than what we really know. In epidemiology, you always see the tip of the iceberg. There is something below that is brewing that you cannot see in the data, but you get a feeling for it. And the race against the variants is as quickly as we get immunized, as many of we get immunized, the more that we get immunized, the less likely is for these variants or any other infection disease, in this case that has a vaccine for it, to transmit, to go far enough to create an issue. We know that we are going to have small outbreaks. We know where those outbreaks may occur, with which age, because of the level of vaccinations. So we know that people who are 65 years and older are vaccinated over 86%. So that is herd immunity right there for that age group. So we are less concerned about that. Our concern is school children younger than 12 who have not been deemed eligible for the vaccine yet. Although that's about to come before the end of the year, some people think maybe by September. But we have 12 to 17 years old. We only have vaccinated less than 30% with one dose. And we have over 200,000 students in our system, just the public school system. So it is important, if we want the schools to function, if we want the student to learn, if we want the teachers to be protected, it is important to get use of the vaccine. And again, the vaccine is available everywhere. We have more than 100 places that are giving vaccinations in Orange County. We have more inventory than we have demand. It's plenty. We have 3 types of vaccines. We have the Pfizer, we have the Moderna, and we also have the JJ, which is a one dose for those who may be afraid of needles. So we have choices in front of us. And we are putting the vaccines everywhere. We are bringing it to the supermarket. We are bringing it to the parking lot, to the store, to the hair salons. Please be vaccinated. And for employers that have, people who work shift, who work 6 days of the week, please consider giving your employees the time that they may need to get vaccinated and to get their children vaccinated. It is important for you to lose 1 day of work than 14 days of isolation or quarantine next time.
All right.
Nikki Zizazo with News 6. This question's for Dr. Pino. Dr. Pino, the CDC classified the Delta variant as a variant of concern. And so to Orange County residents who may say, look, I'm vaccinated, should I even be concerned about this Delta variant? I understand that at least 2 people who contracted the Delta variant were vaccinated. So what level of concern should people who are vaccinated? It sounds like you're urging people to get vaccinated as a way to prevent themselves from getting it.
So with vaccines, so these vaccines are very good. They are quite one of the vaccines that we're ever seeing around. They are effective about 92, 93%, give and take depending on the vaccines. And of course you have, let's say 95 to make it simple. You have a 5% chance, just a 5% chance that you even vaccinated will get infected by the virus. But what is happening to people who are vaccinated, who are getting the virus, is, and those breakthrough cases, is that many of them are asymptomatic, and other people have experienced little symptoms, and hospitalization among people who are vaccinated, even after they get the virus, if that's the case, is basically non-existent. Very few cases get hospitalized after, having the virus for the second time or after being vaccinated in this case. But the idea is that now because that risk level is 60, which is very low, we should not discourage people from getting vaccinated because there is a little chance that you may get the infection even after you are vaccinated. Those are very small numbers. And even when that happens, the disease is less traumatic for the individual, hospitalizations are less, and death, although we have one case, and we can argue about that, is less significant. And that's why we have seen such a decline in the death rate from month to month. We are at the end of June, and we only have 16 cases so far this month that have died that are county residents. Last month prior to that, the number was 54 in May. So there is, the vaccines are working. Let me give you, just death, let me give you the numbers. In January, we have 229. Remember, we start vaccinating December 26. In December, we have 121. In January, we have 229. Thank God we start vaccinated in December. In February, we have 112. In March, we have 58. In April, we have 58. In May, we have 54. And in June so far, 16.
All right.
Hey, for the doctor too. This is Emilio Ramos from Telemundo. This is a lie. No. I'll ask you in English, and if you can answer in Spanish too, that would be wonderful. Have you identified, or are there still pockets within our Hispanic community that either don't have the easy access to the vaccine, or they just don't want to get it because of lack of information? I know this has been the story throughout the country. What is the case here in Orange County, and how aggressive are you guys going to be to get them to get the vaccine?
I'm going to respond in English, and then I will do the same in Spanish. So, yes, there are pockets of our Latino community that have not been vaccinated, and the hesitancy to get vaccinated seems to be greater among people of color, reflecting in the numbers that we have. People who we are familiar with, I mean, last time I was telling the story about a restaurant that I go often. I went there for lunch today. And I will tell him that I mentioned it. And by the way, the vaccine truck will be this week on that parking lot, so that they don't have any excuse to not to get vaccinated. I may go and smoke them out and force them to go to get vaccinated. But no. Besides the humor, the reality is that in our community we have a large number of people who are not vaccinated. And access is not only having the insurance or having the vehicle, it's also access is having the opportunity and having the time to get vaccinated and to take your child to be vaccinated. What happened in the Latino community is that we have a large segment of population that is not documented, and that add some layers of fear in our community to come and get vaccinated. And we also have a large number of our population works in the service industry, working long shift basically every day. Some of them working 2 jobs, 3 jobs. And that's why I'm appealing to employers to give their employees the time to get vaccinated and to get their kids vaccinated. In Spanish. Sí, hay pockets en nuestra comunidad latina que no han sido vacunados. Y las razones pueden ser muchas. Estaba diciendo yo que acceso a una vacuna no es solamente tener seguro médico o tener el vehículo, es también tener el tiempo para ir a vacunarse y para vacunar a tus muchachos. Es por eso que también le pedía yo a los empleadores que por favor le den a sus empleados el tiempo que necesiten para vacunarse y para vacunar a sus niños. Mucha gente en nuestra comunidad trabaja en la industria de servicios con 1 o más trabajos, 6 días a la semana, llegan a casa tarde, muchos de los lugares están ya cerrados. Y como dije anteriormente, los empleadores tienen que pensar que un día o medio día hoy libre para irse a vacunar, están ahorrando 14 días en que podemos poner las personas en isolación. ¿Cómo se dice en español? Isolation. Aislamiento. Siempre se me olvida. Aislamiento y cuarentena.
Dr. Pino, Emily Braun with News 13. You mentioned that the Delta case count now is just the tip of the iceberg, that you suspect there are more. So can you explain how testing for this variant is happening, how often it's happening, and what lab resources and capabilities there are for testing for this variant right now?
I don't have all the information specifically on the numbers, and I know Albina is watching right now. So we will come prepared next press conference to give you all the details about the sequencing, the genome sequencing, how is it happening, how many cases, what is the proportion, what is happening.
Paul Rivera, Channel 2. I think is Orange County School District here as well?
Yes, Ms. Sherry Babinski.
So I just have like a quick policy question, and then I have a follow-up question for Dr. Pino.
Ask me first what you walk.
Okay. Well, yours might be a little longer.
Oh.
So. It was on COVID cases for the next school year. How are we going to be reporting those? Is that going to be a daily thing at each school? Is it a weekly report? And are you going to report vaccines?
Yes. The first semester is probably going to look much like how we were reporting at the end of the school year. Our dashboard will continue through the first semester, and notifications will continue.
With the state not putting out this data for COVID numbers and vaccines,
The data, we have no issues with the data. We have the same report that was generated by the state, generated by our department daily for our review. So that's not an issue right there. The state went to a weekly data analysis because the number of cases has significantly decreased across the state. It just made sense as you demobilize to also start demobilizing those resources. It's a lot of resources to be able to do analytics. And, but the number of deaths that you were mentioning is just because sometimes the review process takes a little bit longer. Sometimes someone dies in another jurisdiction and they have to be reassigned. So there are some other factors in the processes besides the data analytics that have an impact in how and when the deaths are reported.
You're able to track everything just
Yeah.
fine
The way it is, we are fine.
Dr. Pino, this question was texted in from Brian Lynch in the Orlando Business Journal. His question reads, with the new variants, what kind of concerns do you have for some of the holiday weekend events? Could we see similarities to the impact of Memorial Day 2020?
No, we shouldn't see that. It will have to be a variant that comes very aggressively and is resistant to vaccinations or to vaccinate individuals. The numbers that we have of vaccinated people, over 57%, indicates that although it could be higher, and we know it's higher due to, federally not reported data to us yet from the VAs and from the Department of Corrections and the Department of Defense at the state level, at the federal level, that we know our percentage are more in the 60, 64, and those numbers give us the protection at the community level for not having major outbreaks. I think what we are going to see is just pockets of outbreaks. Our ability to control those is going to determine how expensive those get.
Okay, it does not appear that we have any other questions. With the holiday coming up, the next press briefing will not be until July the 12th at 4:30 p.m. Thank you all for joining us today.